Meanwhile, the federal government has attributed the standoff with the National Association of Resident Doctors to structural and policy issues rather than neglect. Minister of State for Health, Dr. Iziaq Salako, says there is a 90 billion naira annual increase in health workers' allowances covering call duty, shift duty, non-clinical duty, and rural posting allowances. He says the government has adopted a collective bargaining approach to address pay parity and relativity issues, which has reduced the demands of the doctors from 19 to 9. Well, the Minister of State for Health, Dr. Iziaq Salako, joins me now to discuss the proposed strike and government's position. Glad to have you join me, Honorable Minister.
Thank you very much.
Well,
and it's a pleasure seeing you again in the new year.
Yeah, it's a pleasure having to discuss with you again. Happy New Year, by the way. Yeah. Well, you watched the Mohammed Suleiman there. The resident doctors claim that after the agreement between them and the government, which of course resulted in the strike being cancelled, that was last year, the government just dumped it, didn't do anything about it, and they're saying it's irresponsible of the government. And the question is the government being irresponsible?
Well, first let me say that we do not believe there's a standoff. A standoff means that, how should I put it, a kind of, what English word to use now, I can't think about it. Because we continue to engage and we're making progress. Like you alluded into your intro, we started from 19 points demand. And if we have dumped everything, we would not have been able to reduce from 19 to 9. When the strike started, they were talking about 25, 35 allowances, which was an issue for about 7 years. We have paid that. They were talking about accoutrement allowance. We have paid that. They were talking about release of increase in professional allowances. The circular has been released, and that is going to cost the federal government additional about 90 billion on an annual basis increase in the pay of health workers. So there has been some progress being made. The general principle that we are introducing, which appears to be strange to our health workers, not only NAD, even other health workers, is that we're introducing first the principle of collective bargaining. In the past, government used to talk to health workers individually. They talk to JOESU, they then go and talk to NMA, maybe they now talk to nurses. And if you now reach an agreement with nurses, for example, and you implement that agreement, the doctors come and say, that agreement you implement with nurses, it has affected us. You have to also talk to us. And then you talk to doctors, the nurses will now came back, okay, the agreement. So we now said, look, this time around, we're not going to be implementing agreements with health workers piecemeal, because that is what is actually responsible for a vicious circle of negotiation and strike, negotiation and strike, negotiation and strike. And that is why when we were going to do the circular that we released, you will see that when it was first released in July last year, and there was a complaint, we actually moved and withdrew that circular. The Salaries and Wages Commission introduced that circular, and it was removed. And then we commenced the negotiation with everybody, and eventually we were able to get that circular released. At least reasonably, all health workers accepted it, and nobody is seriously complaining. In fact, doctors hailed the circular when it was released. So that is one principle that some of them don't seem to appreciate. The other principle is that we have also decided that government should no longer be stampeded with strikes into reaching agreements. Because the experience is that when you are stampeded into reaching agreements, the agreements are not enduring. And you just find out that you just do that agreement in about 2 or 3, 4, 5 months, you have an issue again with it, either with another set of the health sector or the same set of people that you have had reached agreement for. As an example, the issue of specialist allowance, which was one of the issues around the strikes in November. When the resident doctors introduced the need for them to be paid specialist allowance, the ministry wrote to the head of service. The head of service sought the advice of this National Salaries, Income and Wages Commission. We wrote since November last year. And eventually, the Salaries and Wages Commission came and advised us that specialist allowance are exclusively for consultants, not for resident doctors who are specialists in training. So what it means that if we reach an agreement that we're going to be paying resident doctors as a result of stampeding of strike, we will not be able to implement it.
So let's talk about, I mean, that's what everybody wants to hear, and all ears open. January 12th, just less than a week, 6 days from today, thereabout. The doctors say if the government, they will go on strike on January 12th, on the 12th of January. Yes, I'm correct. Because of continued failure of relevant authorities to fully implement agreements reached on doctors' welfare and conditions of service. So, what are you telling Nigerians? Is the strike going to go ahead? What is government doing to stop it?
Yes, what I can tell you in terms of our wishes from the side of government is that government is doing everything possible with respect to the welfare of health workers, including resident doctors. You know, I am not denied, and they are the ones that have declared to go on strike. It's not government. But what I can tell you that every item of their 9-point demand that they have now brought forward, each and every item is being addressed by government. Each and every item. There is none of them that is not receiving attention of government.
Let's talk about the issue of this restatement of 5 doctors at the Federal Teaching Hospital, Lokoja, payment of promotion and salary arrears, full implementation of the professional allowance table with arrears captured in the 2026 budget. What is it with this restatement of doctors? Because I was discussing with him the other day, and he said that the trick government is trying to use is to post the doctors where they don't want to go. Explain to us what's the
All right, so you have mentioned 3 issues, and I'm going to quickly address those 3. First, with the posting of doctors, the 5 doctors. Now, those 5 doctors fall actually into 3 categories. They are lumping them together. They don't belong together. There's category 1, 2 of them that face a senior staff disciplinary committee of the federal ministry, which the staff disciplinary committee recommended that their appointment be terminated. That's category 1.
Okay.
There's category 2. 2 others who also face the senior staff disciplinary committee, that the disciplinary committee recommended that they should be reprimanded.
Okay.
And that's category 2. There's another category of 1 doctor who could not face the senior staff disciplinary committee because she was unavailable when the committee was sitting. She was ill. So they are not the same. So what decisions we have taken in each of these 3 categories is also different. For example, the doctor who has not been able to meet and present her own defense in front of the disciplinary committee, even though the committee that we set up to review has recommended that she should be reprimanded, we said no, because reprimand is a punishment. So let her go and state her case with the disciplinary committee. The disciplinary committee may even find out that she doesn't have a case to answer. So that's category 1 that we have agreed to. Category 2, those that have been recommended for reprimand, we said, okay, write to them, reprimand them, let them be of good behavior, and let them continue their work. The 3rd category, which are the 2 doctors that have been terminated through a disciplinary committee, we now said, okay, write to them, let us reinstate them, but reinstate them in another institution. That is the situation with the ministry. So, whereas they are lumping 5 doctors together, we have separated them by studying and identifying the peculiarity each of these doctors. That's number 1. 2, professional allowances. Like I said, the professional allowance circular has been released since November last year, and we have costed that it's going to cost government about 90 billion to implement. This has been taken care of in the 2026 budget. I don't know where they have the information that has not been taken care of. If you go to the budget office, talk to the Director General of Budget, he will tell you categorically.
Was it communicated to them?
You see, the truth of the matter is that when you do a wage award,
yeah,
the circular is routinely circulated for budgeting. It is not, it's a routine process. It is government gives a wage award definitely you have to budget for it. So it is routinely circulated to the budget office, and budget office has assured us that there is enough provision in the service-wide vote of the federal government to take care of this award, including other envisaged wage award that may happen in 2026. That is on that one.
Okay.
On the issue of, what was the third thing now?
Oh, well, I mentioned implementation of the professional allowance table, with areas captured. Okay, you talked about that.
Talked about that.
An official clarification from the Federal Ministry of Health and Social Welfare on skipping and entry-level
All right.
issues.
Now, the issue of skipping. The issue of skipping has been something that has been on since 2013. Juesu went to court, to the industrial court.
I'm not stopping you while you're discussing that. Yes. Let me just add that Juesu has been on strike for 52 days.
Yes.
What's happening?
No, I'll get to that. Let me just quickly explain this issue of skipping. Now, Juesu went to court, to the industrial court, and got a judgment that they will skip level 11. When they are doing promotion from level 10, instead of going to level 11, they will go to level 12. Now, the ministry and the Salaries and Wages Commission is against that, so it was appealed. But because they have a judgment subsists. Now, as a result of that judgment, the doctors approached the government at that time in 2013 that if Juesu is enjoying skipping, they should also enjoy skipping. But it is now found out that the equivalent of level 10 of Juesu is Commerce 2 of resident doctors, which is the entry level. So which means they are going to skip at entry from level 2 to level 3. This has been a very controversial, but we've written to the head of service about it, and the head of service has said, okay, with the status quo should continue, that is entry level of level 3, pending the time that this issue can be ruled by the appeal court, because the issue is on appeal, or the council and establishment can harmonize the position on it. Now, with respect to Juesu that you ask a question, this is also an issue that has been long-standing. The Juesu as an association had an agreement with the federal government in 2009, saying that the two salary scales in the health sector, that is CONHES and COMERCE, that there should be parity between those two salary scales. A few years later, the doctors also approached the government and got another agreement with the government that there will be relativity between COMERCE and CONHES. All of us know that you cannot implement parity and also implement relativity.
Before I let you go, Honorable Minister, I have to ask you this. What is it, the implications? I mean, one doesn't hope that, just quickly on that, maybe 30 seconds, implications of another strike on the health sector.
No, for us, we are going to do everything to make sure that today they had a meeting with directors in the ministry, with the Federal Ministry of Labor, and we're hoping that they will see that federal government is committed to ensuring that there is long-lasting, enduring solutions to the challenges in the health sector.
That's it.
We're in the direction of moving down.
Enduring solutions, so we don't keep having this strike up and down. Thank you so much, Honorable Minister of State for Health, Dr. Iziaq Salako. Glad to discuss with you again on this. We hope that come Monday there will be no strike.
Thank you very much.